Hi, my name is Kelly, and I'm going to be talking about the history of schizophrenia and how it affects healthcare today. So in this presentation, I'll be discussing schizophrenia and the history that follows along behind it that has changed the way we look at mental health and the way we treat it as well. So let's start off with what is schizophrenia. Schizophrenia is a mental health disorder where people interpret reality in abnormal ways, such as hallucinations and disorderly ideas, with behaviors that can be disabling. Some associated terms or symptoms that is associated with the schizophrenia diagnosis is like psychosis, delusions, abnormal thinking, or disorganized behavior. People who have schizophrenia are often categorized in groups with people such as homelessness or joblessness, or even people who have served time in jail. This is a huge issue because less than 1% of people are diagnosed at an appropriate time with schizophrenia. So why is this important? In the 17th century, mental health disorders were not recognized as a health issue, but people were seen as being possessed by demons or have some sort of witch involvement. Religion had a huge part in the way people thought and what people did. So even people who have epilepsy, they would think are possessed by demons. People with mental health disorders really struggled to find help because of religious views. So further on into the 18th century, whenever healthcare started accommodating mental health disorders, they would put them in hospitals or asylums, and they would store them there for them to live, but healthcare providers wouldn't take care of them. The families of the patients would have to come and take care of them. They described it as an alternative to jail. And the treatments back then were way different than what we have now. They would do like insulin-induced comas, lobotomies, and electroconvulsive therapies, which they still do electroconvulsive therapies today, but you are sedated and watched very, very closely. These treatments often led to severe brain damage, like neurological distress, poor memory, poor motor skills, and death, if not immediate, eventually due to infection or long-term issues. There was no way after getting these treatments that people were able to live a normal life afterwards. So what did people do? Eventually, in the 19th century, they were able to come up with medications that helped. So they categorized these medications into two different types of medications. You have your typical and atypical, or first generation and second generation. Your first generation took care of positive symptoms. Positive symptoms are additional symptoms that one may have that is out of the norm. These symptoms include hallucinations and delusions. Those medications were incredibly toxic and cause a lot of long-term problems, and they could also cause what is called tardive dyskinesia, which is irreversible, super jerky movements. So the second generation medications took care of the negative symptoms, or symptoms that are taken away from a person. So a flat affect or a severely depressive mood would fall under this category. So these medications don't have as severe as an effect on, per se, a normal person, but somebody with comorbidities such as heart defects or kidney injuries, hyperlipidemia, stuff like that, they're at a greater risk for long-term effects. So this is super important, and it's important to understand not only the difference in the symptoms, but understand that schizophrenia as well is just an umbrella term for other health, like mental health problems, such as delusional disorder or schizoaffective disorder, while these are very, very similar, they needed to be treated differently and they need to have a different approach. The biggest problem with the approach of schizophrenia is that it's normally not diagnosed early. It can be diagnosed as early as teens, but it normally isn't diagnosed until late to mid-20s, if not later. And people normally show symptoms that early. It's just whether or not somebody takes the time to put all the puzzle pieces together and say, oh, well, they have this disorder. And if they are diagnosed correctly, are they going to be treated correctly is also a big problem. So it's very, very important not only to get all of our ducks in a row, but to understand why we're doing it and what risk you can put people at if the appropriate treatment is not available. So having these treatments available can help somebody live a long, purposeful life. They can have a job without deficiencies. They can do normal everyday things, because if they don't get those things or they don't get the right treatment at the right time, they're going to fall into those subcategories with, again, homelessness, joblessness, jail time, and it could all be prevented if we had appropriate care. So, thank you.